So I'm going to get right into it. We're all excited about Mayor de Blasio's new housing plan, but the fact is the state controls an enormous amount of the resources that are necessary for such a plan. And these are resources that the governor has grown since he took office. I think in some ways the mayor's plan would not be possible without the foundation that Governor Cuomo has built in the affordable housing arena. What would you say are the most notable actions that the governor has taken in the last few years? And I'll start with Fran in affordable housing.
Well, I think that what the governor has done has to be put in a particular context. Anybody who watches state government knows that putting aside the issues we're speaking to today, he has made as one of his core missions to bring the state back to financial health. And that has required making some very tough decisions about how we prioritize the dollars we have. We have had to live under very strict spending caps in the state to bring fiscal stability back so that we can do the kinds of things we want to do for the people of New York State, but do it in an environment that is stable, that can last for the long term. That means that some areas of public policy have not seen the kind of growth that some might think important. Governing is all about choices, and Governor Cuomo has made some incredibly tough choices. So I think it says something about how he feels about affordable housing globally and how he feels about supportive housing more specifically, that this is an area where, despite those spending limitations, we have grown budgets. So we can all address sort of what the highlights of that are. But the House New York initiative and unlocking the mortgage insurance fund to add housing funds, bifurcating tax-exempt bond awards in the 80-20 projects so that they pay only for the affordable units, freeing up tax-exempt bonds for other affordable housing developments. Courtney, you should talk a little bit. I'm sure we'll get into it more about MRT, which there have been already some we've heard a little bit about.
Yes, absolutely. And I think the numbers speak for themselves when you look at the Medicaid redesign team. We started in 2012 at $75 million. We've been growing that every year, 86, 100, now $127 million being reinvested through the MRT process. The numbers speak volumes, but what I think is probably more important about the Medicaid redesign team and that process of reinvestment is the acknowledgement by the field that health is not just about health. In fact, I've read that if you think about health, it's really only about 10% in terms of medical care. The rest is other things that people need in their lives to be healthy. Housing is a critical component of that, and I think the governor has recognized that through the investments that he's made. It's also a culture change to me because for the first time you have all of the agencies, not just the ones represented here, but all of the agencies in the state, sitting at the same table, talking about how to smartly reinvest money so that people have better health outcomes.
So I think it's also very important to note the great focus on the humans that New York State is focused on, and I want to give credit to my predecessor, Commissioner Proud, who guided through the state budget an enormous increase to the homeless housing and assistance program, doubling that program. And working across divisions, also with health this year, we looked very closely at older programs that might be restructured to assist certain population groups. And I think it's of note was the change to the HIV/AIDS disabled community with the 30% rent cap, which really was an equity issue and a critical partnership.
And I think, am I correct that in the current budget year, we doubled the HHAP budget? So there's,
It's definitely worth an applause.
30 million to 63 million, and that will account for more than 1,000 new units.
We should mention also, I think, which was also very important in this year's budget, investments made in the mental health system. $6.6 million increase for rent subsidies downstate, $7 million across the state in reinvestments, which will result in 600 new units of supportive housing.